My name is Betty Jean Gray, and I'm from Orlando, Florida, originally born and raised. Always been very, very active in my life. And then at age 38, I was diagnosed with severe osteoarthritis in my back and my hips. And I thought it was a joke because I was very young. But at 45 years of age, I had both of my hips replaced at the same time, 5 days apart, and was back working in 3 weeks on a walker. I had my one hip replaced because it was 20 years old in 2016. And then I had the other one because I had complications from the left hip. It took me a year. I had the right hip replaced. Then I had a spinal fusion done from S1 to T10. Then 10 months later, I had both my knees replaced at the same time. So that was all I had when I was in Florida. But that was in 2.5 years, I had 4 surgeries and multiple physical therapies. And then I moved up here and my shoulders started bothering me. I had orthoscopic done in my left shoulder in July of last year, and to buy me some time, and it didn't work out. So I went full into total shoulder replacement of my left shoulder in November of last year. And in June of this year, I had my right shoulder replaced. And when I had my left shoulder and right shoulder replaced, I had both of my thumbs done at the same time, CMC suspensions. I went in from the orthoscopic surgery. I was in a lot of pain. She immediately got me out of pain. And then went from there and set up my program for me. And I'm like, this is good. Hey, I'm in a good place here. So that was my motivating factor of having my shoulder replacement done so quickly, because I knew I was going to be in good care.
Hi, my name is Kelsey Mancini. I'm a physical therapist at the Rehabilitation Center in Boone. I've been working with Betty Jean for several months now. She's come after a few surgeries. After meeting her, it was clear we'd have to come up with a pretty specific plan for her, as we do with everyone, but she definitely has a more unique orthopedic background. She was in a lot of pain when we first met, so we really focused a lot on managing that pain. I've evaluated Betty Jean, and after evaluating her and seeing what her problems are and what her goals are, I create a plan in order to change her deficits in order for her to meet her goals. I then spoke with Tiffany, and she could read my notes as well, to carry out that plan with Betty Jean so that we can work on her issues and get her to where she needs to be together. As she's progressed in her rehab program, we've been changing that program and definitely making some changes based on her presentation. Someone like Betty Jean may not follow a cookie cutter type routine, so we definitely have to look for ways to make things more achievable for her, and she's done an amazing job. Really a team effort, which I think is true for all of our patients at the rehab center.
It's been amazing for me. I can't do certain things standing up, and etc., because of my spine fusion. So the PT and the PTA have thought outside the box and have developed special exercises for me to accomplish the same thing that I would have accomplished if I could have stood up straight. It's been amazing. I could have not rehabbed like I've rehabbed now. I have a variety of exercises, so when I go home to exercise in my gym, I have things that I can do every day that I'm not doing the same thing and get bored, and I'm accomplishing the same thing. I love the quietness of being there. They put you in private rooms. If you come outside, there's not a lot of noise going on around you. Barbells aren't jangling. People aren't talking loud. It's like you're in your own little private zone where you can listen to the physical therapist and you can do your program like they set up for you. But this place is a godsend. I can't say enough about it. I feel that a lot of the people that live here and go there because the doctors tell them to go there, so they don't really appreciate what they really have and how good a therapy that they're